Okay, tonight's topic is going to be about, is it possible to have a healthy root canal? Fact or fiction? And I'm going to try to show you some things that may be new for you, or maybe something that you want to chime in at the end and talk about a case maybe that you have. First off, the best way to do a root canal would be if the ideal endodontist, who does root canals all the time, goes in and removes as much of the pulp and the lymphatics and the blood supply from inside of the tooth, and then they use a laser and ozone, and they use sealers to seal the pulp. But even at all of that, the tooth may still fail. When we look at how a tooth is in the anatomy, there are these small little accessory canals that can come off in these little areas right here that the dentist can't see. It's not possible. And so here is 2,400 human teeth that were injected with dye to try to look at the morphology of the different canals inside a teeth. And I put the link on here in case you wanted to see it. But the next slide that I have is actually a black and white image of that. So you see that it's not just that a molar has 2 canals and a maxillary molar has 3. There are these accessory canals that go back and forth in between them. And that becomes part of the issue for a dentist, because again, you can't see what you're dealing with. You're going based on feel alone. This is research that's been quoted time and time again, and I'm going to try to stress to you about why this is so important. Dr. Steinman in Loma Linda did research that proved that the flow of a fluid from the tubules in a healthy tooth went from the inside of the tooth towards the outside. The way I describe that to my patients is you brush your teeth at night before you go to bed, and they're nice and slick. And when you wake up the next morning, there's fur on your teeth, because a healthy tooth detoxifies and pushes its waste products out through the tooth to the outside of the tooth. This means that there are microscopic openings on the tooth on the outside of the root surface, and that becomes super important. We'll talk about why as we go through here. So this is a microscopic view of those dentinal tubules, and they are so small that a white blood cell can't fit in there, but many bacteria can fit side by side by side and get into these particular tubules that are in the tooth. And so we're going to pretend that we could sterilize this tooth. Now, I've already told you it's not possible. It's not possible to sterilize a tooth. We can sanitize it, but we can't sterilize it. But we're going to pretend that we can. So what about the flesh that's left in the tubules that goes sideways? As that flesh is robbed of the blood supply coming in through the main pulp chamber, it starts to break down and become mushy, and it turns into a breeding ground of this pulpous type tissue. If I had a soup bone and I buried it in the ground, I dug it back up 3 or 4 months later, there would be no marrow in there. The marrow that was inside the bone would have broken down into mush, and bacteria doesn't need blood supply in order to move. Healthy white blood cells require blood supply in order to be able to move. The bacteria does not require a blood supply at all. Now, when we look this picture towards the left side, you see those tubules that are going sideways. So let's pretend that this tooth has had a root canal and that the inside chamber has been completely sealed. This was done by an endodontist. They lasered it, they ozonated. It was the best they could do. But these sideways tubules still have mushy pulp that's in there, that all the dentin that started to degrade, and it still has that opening that's on the outside. Remember, I said bacteria does not require a blood supply to move. The anaerobic bacteria finds its way to the side of the tooth through those little openings and gets in to those tubules that are going sideways. And depending on who you read, there's 3 miles of tubules in some of these teeth. It's now a heaven of sorts. It's a dark, moist, warm environment with tons of mush for them to eat. That bacteria now multiplies, and it can move back outside of the tooth. It can jump into the bloodstream and set up a secondary infection anywhere in the body. It can even create a problem for an adjoining tooth. It can create a problem for a brain if it ends up causing a brain abscess because of this. So again, that becomes critical, is that the root canal itself, even if it's sealed, it's that we can't clean out those sideways tubules. This is a good picture of some of the growth that occurs inside of those tubules. This is with a micron microscope. Now we look at the evidence and we see that here was some research done with 26 different patients, and they weren't experiencing any pain at all. The anaerobic bacteria that was found in there could cause pneumonia or acne or necrotic tissue infections among some of the ailments. These pathogens also serve as major inflammatory mediators inducing disease anywhere else in the body. So let's look at some of those. Here's Pseudomonas. Some of the strains of the bacteria are antibiotic resistant and can ultimately cause death. Not cool. But some of the symptoms are associated with a weakened immune system or pneumonia or blood infections. Then we have Staphylococca, commonly referred to as just staph. These bacteria are often skin infections, but you can also be involved with pneumonia, blood poisoning, and even toxic shock. Or the all-important Streptococcus. Some strains of this bacteria can be referred to as flesh-eating bacteria. This bacteria is linked to symptoms related to our traditional strep throats, serious health complications involving pain, fever, swelling, dizziness, rash, confusion, abnormal blood pressure, and even toxic shock syndrome. Now we have the Enterococcus faecalis. Its presence is in almost every root canal. It's the most prevalent and virulent bacteria strain found in a root canal. It can cause urinary tract infections and meningitis, and oftentimes it's resistant to different antibiotics. And it's not just the bacteria itself, but the byproduct of the bacteria that is so harmful. So one of the founding members of the Root Canal Association was Dr. Meinig, and later I'm going to show you a picture of the copy of his book. But he commented on a study that was performed by Dr. Weston Price in the early 1900s. Guys, this is not new stuff. We're talking about things that are over 100 years old now. Dr. Meinig noted that the cause of secondary infections was not solely dependent on the bacteria itself, but the production of the toxins from the bacteria. Dr. Price's work involved taking out root canal teeth from people that were patients of his that had become ill, and they scrubbed the outside of the tooth and they slipped it under the skin of rabbits, almost completely wiped out the rabbit population in Ohio doing this research, and found that the person would pass on whatever was their health malady would manifest in the rabbit. And that became really interesting research. So Dr. Meinig went to his peers and said, I don't think that root canals are bad. Obviously, that's how I'm making a living, but no one's ever really looked at what happens when we taxidermy a tooth. Maybe we need to be doing things a little differently. And actually, they just flat laughed him out of the association. And he ended up writing an incredible book. So if we use ozone and lasers, which by themselves, they're amazing. You know, we use lasers in dental hygiene, we use it in dentistry, we use the ozone for everything, and we know that it's antibacterial, antiviral, antifungal, antiparasitic. That is undisputable. So if I have a dead cat, which is the analogy I love to use all the time, and my dead cat was my favorite cat. He's on my kitchen counter because I just can't stand to bury him, but he's got maggots all over him. So I call a pest control to come out. And the pest control says, oh, we have the latest and greatest stuff, ma'am. We can ozonate your cat and we can kill all the larvae that are on there. Great. We could even laser your cat and make sure we get all the bacteria and virus, everything. That'll be a sterile cat when we're done. Great. A week later, I have new maggots. So I call the pest control company. I want my money back. that ozone and that laser, you promised that it would kill everything, but I have new bugs. Well, of course you have new bugs. Lady, you didn't throw your cat out? No, I didn't throw my cat out. It's my favorite cat. We have to consider the fact that this root canal has bacteria inside that we can't get to. And even when we use ozone, which is a great gas to permeate through different things, the laser can only go in a straight line, but it does a very efficient job where it can get. But the issue is we can't get all the dead flesh out. So that tooth still has remnants of dead cat all through the side of that tooth. I personally have never seen a root canal tooth that when sent out for culture didn't come back with anything other than tons of bacteria, including Borrelia, which is connected with Lyme, and botulinum. The next report that I'm going to show you is on a tooth that was extracted about 3 weeks after the person had laser treatment done. Now, this was long ago. There wasn't really ozone, so they flew all the way out to California to have the tooth, the root canal tooth, lasered, and they were told that this $1,200 procedure for this tooth would sterilize the tooth. The patient came back, and they were still having some discomfort. This is their ALT testing. ALT, Affinity Labeling Technologies, used to be Dr. Boyd Haley's company, and it was purchased from him, and if you talk to him, you'll find out it was kind of a corrupt deal. The people that actually bought it from him are involved with root canals, and they burned all of his research just because they didn't want it to be out there. But those of us that were doing his testing have access to our old reports, and this is one of mine. This tooth, which was the tooth that was the most problematic for this individual, was tooth number 19. It had been lasered 3 weeks before. We extracted the tooth and sent it off for them to look at the amount of inhibition that those bacteria were creating. So these are the enzymes that are related to your body's ability to create ATP. So if you look at this, you have what, a 38% reduction of the enzymes that are going to help this person have energy. Well, that's not the main thing. Here's what happened. This same person 6 months later said, I just feel like crap. I don't know what it is. I feel like I have chronic fatigue. I just have no energy whatsoever. I do remember the report that came back on that one tooth. I just want my other root canal teeth taken out. And we said, gosh, are you sure? These are front teeth. You know, the one that was taken out back in the back, most people are willing to give up a posterior tooth, but giving up an anterior tooth is really a big deal. Those 3 teeth were taken out, and we sent them to the same lab for testing. And you look at this and you see that there's 78% inhibition of the enzymes to create ATP. Just amazing in this particular case. If you want to read some good books, my first suggestion is that you read George Meinig's book. That's the dentist that I talked to you about. It really is a very basic book, and it's amazing what is held back and not even told to the general population as far as just conventional dentistry. The second is by Dr. Levy, and Dr. Levy's been so gracious to speak for us on a couple of different occasions at our conference, but he also did one of our Zoom meetings for us, but he did it on vitamin C. I encourage you to watch that as well. But 2 really good, easy reading books. So now that we've got you mainly convinced that there's this mush in the sideways tubules that is going to create bacteria coming to that environment and then multiplying and creating an infection in the body. You may not have any discomfort whatsoever. That is not my issue. I could care less about the bacteria. I think that people get cancer multiple times in their lifetime, and if you have an adequate functioning immune system, your body kicks into gear and squashes it. So my issue is that it's an electrical problem. What you've done is you've disconnected this tooth from the rest of the body. There's no place in medicine that we taxidermy your tonsils or your adenoids or your gallbladder. If they go bad, they get removed. And that recreates the flow of electricity through the body by taking out the dead portion. And I'm going to try to describe that to you. If I have a lamp and I know that it works, but now I'm going to cut the wire and I'm going to remove an inch of the wire from inside the cord. If I plug it back in, because it's disconnected, the light bulb's not going to turn on. Everybody understands that. It doesn't matter if that wire is completely sterile or if it's sitting in Stachybotra or if it's sitting in dog poop. It makes no difference, sterile or bacteria. The issue is an electrical issue. And in order to fix this, we have to splice the wire back together. So if I have a laser light and I shine it at a wall and I take a simple piece of paper and put it in the line of that laser light, the laser light doesn't show up on the wall anymore, it's on the paper. That is the way the energy is in your body. So you have to take out not only the taxidermied root canal, but any dead tissue, And it's measurable once it reconnects. Like removing that piece of paper, now my laser light is seen on the wall again, and it happens instantly. If I ask you to look at all these dead people and answer me which is the healthiest of those dead people, it's an oxymoron to say that you have a healthy root canal because it's a healthy dead tooth. You can't say that it's healthy. It may be serving a purpose, it might be functional, but it's not healthy because it's dead. And I hope that I made myself really clear there. Now, having said that, I do understand that different people's immune systems are different. Some people can tolerate smoking till they're 105. Other people can have a bad diet and they do just fine. Some people, stress is no issue for them. Even a dead tooth may not be a problem for them. While I have some people who can die from secondhand smoke, I've got other people who die from secondary infections, and root canals can be a problem for them. I personally always suggest that the tooth gets tested so that we can see if it is a burden to the immune system and what is it a burden to. Most people who do some type of energetic testing, whether it's applied kinesiology or whether it's electrodermal screening, can help you in that situation to find out if the tooth is a burden. The best thing to do is find a biological dentist. That's what we're promoting through all of this COVID-19, is that we want to teach you to be a better biological dentist or introduce you into the world of biological dentistry so that when you go back to practice, you're practicing completely differently. And you're going to share with your patients, I'm a new, improved version of what I was. I remember years ago when I would send patients that I found an energetic blockage and were suggesting strongly that they had a tooth removed. I would send them back to their primary care. Their primary care might write me a nasty note or even call me on the phone. What do you mean telling the person that they need to have their tooth taken out? It's the stupidest thing ever. But then some of these doctors started taking implant courses. So then what they do is they tell their patient, you need to go see this weird lady. She's probably going to tell you you need to have that root canal tooth taken out so that I can put an implant in there. That's not the idea. I don't just tell people that they need to have all their root canal teeth taken out. But when I do see a burden, I let the person know. What's interesting is as those doctors started getting CBCT scans, they would call me and say, oh my gosh, the tooth that you told me to take out a couple of years ago and I refused to, I just did a CBCT on this person and I can see pathology at the apex of the tooth. Duh. Energy precedes the chemistry. So a lot of times we might see something that happens before it's actually happened. But, you know, if you see it, don't just let it manifest there. Really scrutinize it. Now with the CBCTs, I know all of you are finding more pathology in teeth that you didn't even know were a problem before. I wanted to show you some research, and this is one looking at, you know, a CBCT where on regular x-rays, pathology didn't really show up, but on the CBCT they do. And so now we recognize that as more a standard of care, especially if we're going to get in and do something like an implant. You could choose to send your root canal tooth off to see what kind of bacteria is in it. And I'm going to encourage you to do that through DNA connections. So here's a tooth that was sent off. You shouldn't see any red at all. Now that's not a good thing that we see this. So when we look at this, you'll see all this bacteria that's showing up. It's amazing. Let's see if I can get this to show up even bigger here so that we can see some of the bacteria that's in here and what the symptoms are. I hope this is showing up when I went to large screen. Somebody give me a thumbs up.
We can see it great.
Great, okay. And here's more where we're looking at the streptococcus, and you look at some of the problems that can be caused from that. This one as well. I mean, this is different testing than the salivary testing that we were talking about doing earlier in our 5 o'clock meeting. This is more the DNA of what's actually inside that tooth. It's just absolutely amazing. All of this was from that one tooth. We're not even done. Is that crazy? And I think this is the last one. Yep, one more. Okay, so I want you to remember that the bacteria is not the issue. Now, it is part of the problem. And so there are times where a dentist may tell the person, your choice is to either have the tooth re-root canaled, and that might have to happen more than one time. We might have to go in and open it up and retreat it every so often in order to keep the bacteria count down. In those instances, it's more that you're trying to keep a tooth maybe because you're doing an airway appliance and you can't move something if it's not there. So you're using it over maybe a 2-year period, but the patient needs to understand that the bacteria can be a problem. For me, if you've got a healthy immune system, that's what we need to be focusing on, is the immune system. It's that electrical disconnect. So if you disconnect a phone line in the old-timey traditional phones, and you pick it up and it's disconnected, you could call 911, but no one's going to know that you need help, and they're not going to know where you are. That's the issue in the body, is that dead tooth. So the question that I always ask a patient when they say, well, what do you think about root canals? Do you just advocate taking out every root canal? My pat answer is, I do recognize that every root canal is going to be a burden to your body. I am going to ask you a question, how much good health do you have to give away? And if you don't know, then we start looking at what kind of a burden that tooth is to you. Here are some references for those of you that are more scientific minded, really like to see the science behind here. I've been doing this for quite a number of years now, since 1993, and don't need the science anymore. I really kind of believe that disconnect is quite an issue. It's more than coincidental when you start looking at where a tooth is on a meridian and what kind of problem a person has. There's lots of research out there with that tooth being on a breast meridian or a tooth being on a lung or large intestine. And when you either root canal or you remove the tooth and don't remove the periodontal ligament, and we end up with an electrical disconnect there because there's a cavitation where we can end up with problems. I would love for you to all become biological dentists if you're not. If you're just new into this world, I'm going to ask you to request someone to be a mentor to hold your hand and guide you through this. I'm always up for the challenge as far as someone who just thinks that what I said was a bunch of hooey. I also remember starting in dentistry, and of course I'm a dental hygienist who's moved on to become a doctor of integrative medicine, but I was trained to tell a patient, don't have that tooth taken out. All your teeth will move and shift and your bite will be off. We can create a payment plan for you. Only indigent people have teeth pulled. Please, let's do the root canal on the tooth, because that's what I was taught in school. It wasn't until I got out into more medical where we started looking at, well, wait a minute, you're telling the person to save a tooth at all costs, but what are the costs? If all of a sudden my patient who had great blood work now has elevated neutrophils and lymphocytes that are down, showing me that they've got a chronic bacterial infection, that is not their new norm. That means that they have a chronic low-grade infection. and it could be that tooth, but they have no awareness because they have no nerve, no awareness because no sensation. Whereas you have other people who, because there's little nerves that are still there, doctor thinks that they're crazy because they keep saying, I have an awareness, the tooth is still bothering me. It can't. I took the nerve and blood supply out. It's not possible. And yet the person claims, yes, it is still bothering me. I would love to open it up for questions here, so I got to find my little mouse and go down to the stop share so that I can see everybody that's on here. It says, good, somebody says they should not be eating at the table while seeing this. And someone else suggests or asks, would you suggest frequent ozone treatments in case that the patient wants to hold on to the tooth? Actually, you'd have to do something like that on a regular basis. And it would involve more than just that. It's boosting the immune system. You know, you have a disconnect. Let's say it's tooth number 3. Tooth number 3 is involved with the breast, but it's also involved with the pancreas, and it's involved with the thyroid. So if now the person starts having thyroid problems, you might have to support the thyroid if you're going to choose to keep that tooth there. Or you might have to do things to monitor the hemoglobin A1C, because it's not uncommon that someone has a chronic low-grade infection, their blood sugar levels are going to go up. And it might not have anything to do with their diet. You guys are supposed to be fighting me on this, so I know I'm probably preaching to the choir here, but I know that there are a few of you out there that have war stories to tell of your own, where you've had a case that's come in. I personally have seen some really odd things. I remember doing surgery, well, I wasn't doing the surgery, I was doing the EAB, on a lady that we took out a cuspid, and she started crying when the tooth was taken out. I thought she was in pain, so I was patting her hand, going, it's going to be okay, because that's all I know how to do when somebody cries in a chair. And she said, no, I'm not in any pain. I can see out of this eye. And it was an eye that she had not been able to see out of for many years. What meridian is a cuspid on? It's on the eye meridian. That in itself is really strange when you first get into this and you're going, oh, okay, that's just too much. But through the years, I've seen people who have come in with documented cancerous lesions. They're supposed to have surgery on that cancerous lesion. They get their mouth cleaned up and they go in for surgery and they can't find the lesion. Now, you can't tell a patient that you're going to promise anything. And I'm very clear about saying I promise nothing. What I'm trying to do is deburden your body of these disconnects. God made an incredible piece of equipment, and it's us that has a tendency to muck it up. And so yes, I have another question on here. It says, I have some videos to share if you want me to. That's Teresa. Yes, why don't you pick one? And then there's another one on here. It says, where would I find the tooth meridian chart, please? You can go to my website, drdawn.net, and it'll pop up Holistic Health Alternatives, and you can get one of the dental charts there. That would be a good source for you. Teresa is going to show us a video. Is that right?
Yes, but give me a second because I'm on my phone and I need to get on my computer.
Yes, you will have to.
So give me a second.
You will have to. I know there are people like Svetlana that have been doing this for a while, so I'm sure there are others of you that have stories out there to share.
Okay, give me a second. It's loading right now on the computer, so okay. I'm gonna mute so that you don't get feedback.
Okay, no.
All right, give me a sec. Now I have to look for it.
Oh. Well, while you're looking for that, there's someone on here that says they have a question. Let me know when ready so I can unmute. So go ahead and ask your question. I really expected I was going to have a couple people jumping down my throat. So
Hey, Dawn. Okay, so
Yes.
I have a question. Can you hear me?
Yes, I can.
Okay, perfect. So I had a patient. She is 24 years old. About a year ago, we ended up doing a root canal on her because she fractured the tooth. She was actually complaining of a lot of pain on the tooth. We diagnosed it as irreversible pulpitis. She hasn't come back for the crown. Just 2 days ago, she's complained of pain on the tooth again. So I said, well, let's just put a temporary crown on it. The root canal looks fine from my two-dimensional x-ray. I don't have a CBCT, but I did because I have your meridian flow chart, and I was like, well, let me ask you questions. Have you ever had any issues with your breast or stomach? And she's like, oh, it's weird you're asking me that. About a month ago, I had a shooting pain in my breast. And then she had her gallbladder removed, and she's been having stomach pain with that, and she poops like every 4 days. So that's a lot of information. And I was like, well, first thing is I thought she should see a functional medicine doctor, and we're having her go see one. I put a temporary crown on the tooth. But what are your thoughts on that?
Well, again, have the tooth tested to see what kind of a problem it is for the body. I know that there are, there's such an animal called go ahead and mute yourself. There you go. There's such an animal as a regenerative root canal therapy. And I'm going to discuss that now so that we can make sure that we're really clear. Number one, if the tooth has had a root canal for some time, the problem with bacteria is in those sideways tubules. There's no way that you're going to regenerate new dentin in them. I liken the analogy to many years ago when a storm came through. I had a small tree that broke. It was a pecan tree, and it snapped in half. And I was on my way to work when I saw the tree snapped. So I reached in my purse and got out some dental floss, and I grafted the tree back together, and it took. And the tree grew into a nice big tree. If I had a tree that was struck by lightning and it was a 40 or 50-year-old tree and a limb fell off, I would not be able to take that same limb and graft it back on. So the issue in the fact that you've done the root canal means that you've disconnected the energy on that meridian. The tooth could still have a fracture in it, and she could still have pain when she bites down on it. It still could have the accessory nerves at the end that are a problem. So you have to determine, are you going to put a mausoleum on a cesspool? Which means, are you going to have her pay $1,500 to put a porcelain crown on something that you're probably going to have to remove because the tooth is going to be problematic for her later? So my best answer is get it tested.
And what do you mean by that when I say get it tested, like a CBCT?
A CBCT, or send her to somebody that does energy work, someone that does either EAV testing or applied kinesiology and can see if that tooth is a burden. Okay, Teresa, you want to go ahead and show us your video?
Yeah, sure. I've got several. Can you hear me now? Yeah, okay.
Yeah, pick one or two.
Okay, so first thing I'm going to do, I'm going to show you what you see on a CBCT, okay? This one's very short.
Okay, you've asked about how I find cavitations, and I think for me, I find it easier when I scroll through. So in this case, the patient had a cavitation on number 32, and you can actually see this where 32 used to be, right here. So that is a cavitation in my current software, which is iCat Flex. And you can just see it when you scroll through. It's like, oh, there it is. So I'll see if I can find other examples.
Okay, so that's one video, right? Did y'all see that?
Mm-hmm.
Okay, now I've got several, but I have one here who is a functional medicine doctor that I did an extraction on, and she gave me permission to share her video, so I have that. And you can listen to her. And then, like I said, I've got several I am happy to share. So here's another one.
Hi, my name is Paula. I'm actually a physician, and I give permission to Dr. Teresa Scott to share this video for educational purposes. I had a tooth extracted on January 22nd. It's about 3 weeks ago, and prior to that time, I was having headache, jaw pain bilaterally, worse in this side, some pain in my jaw, and just a depressive mood. I had the tooth extracted.
How long have you had the depressive?
I've had depression for years, since I'd say probably about 33 years.
Okay.
And I'm actually a functional medicine doctor, and over the years I've been on 11 to 13 different antidepressants, and through functional medicine, which I've been in about 5 to 6 years, I was able to wean off antidepressants, but my mouth was the final frontier, and that's what we're working on. So I had pain that lifted within 4 to 5 days after the surgery, and my mood has improved. I'm not as snappy and snitty with my family, short. So the extraction has helped. We found that it has a lot of proteobacteria, a lot of
It had some nasty stuff in there, didn't it? It was
severe
disgusting.
gram-negative anaerobes.
Is it okay with you if I show people
Absolutely.
all of that too? Because this
Absolutely.
is going to be seen by all of my babies, people that maybe even you already potentially see personally and professionally, right?
I have no
So-
problem with that.
Okay, just wanted to make sure.
Yeah, so I actually did a study called a Marcon swap. I have Marcons in my nose, Marcons in my jaw, or in the tooth extraction area.
Can you explain to them what Marcons means? Because not everybody knows.
Right. Marcons is multiple antibiotic resistant coagulase negative staph. Coag negative staph is natural, normal flora in the nose, but when you have multiple antibiotic resistant coag negative staph, it releases an exotoxin, and that exotoxin cleaves a hormone called melanocyte stimulating hormone. MSH is made in the hypothalamus, and it's released from the anterior pituitary. So the potential downstream effects are decreased melatonin production, leading to chronic non-restorative sleep. Endorphin production is decreased, so hence depression, anxiety, insomnia. I'm sleeping better, my mood is better.
And nothing else has changed other than taking that tooth out.
No,
Literally nothing
nothing
else.
else has changed.
And you had been suffering for
For years.
33 years.
Right, right.
Wow.
I had made dietary changes, all this, but
Yeah, but that was all prior
Yeah.
to 3 weeks ago.
Yeah.
Nothing's changed in the last 3 weeks, except
Correct.
we took the tooth out.
right. The other thing is I'm not having as many GI symptoms because I've been working on my gut. Now, the DNA connections test that you'll see, Klebsiella pneumoniae, Klebsiella,
Yeah,
there's
some nasty things in there.
another
I'll put it-
proteobacteria, tons of them. Those are also potential autoimmune triggers that I've had in my gut on numerous gut studies, that it's coming from my mouth and I haven't been able to eradicate it. So I think now, once we go through this, that will probably be eradicated. The other thing is I'm having less intermittent joint pain. So I've had a little bit of that. That's also something now that I sit here and think about it, I'm having less of that.
That's really impressive. Just
Yeah.
from the tooth,
Tooth
it
extraction.
showed zero pathology on the CBCT. Like
Right.
it didn't have an abscess on the CBCT. It didn't have any signs of endodontic failure. None of that.
I want to, before I say anything else, it did actually have a lesion on the CBCT. It did not have a sign of anything on the PA. And I got that wrong there, but I just wanted to make sure I confirmed that.
You requested that I get it out because you had the suspicion that there was something going on there.
Correct.
And so we took it out, we tested it, and now we're seeing a difference in your and just how you feel
Overall.
overall. It's
Right.
amazing.
Yeah.
3 weeks out and you just noticed a huge difference.
Right.
Thank you so much for sharing.
Okay.
I do have more videos.
Right. I know Teresa has been very good about documenting more than just our anecdotal things that we've seen through the years. But those of you that have not been in biological dentistry, if you just start looking, you're going to be overwhelmed at how this connection is between not just the root canals, but cavitations as well. There was a question that popped up in here in the chat. It says, what about primary teeth pulp treatment? Does this apply? Yes, it applies. It still disconnects the meridian. My son, when he was really small, had a tooth that abscessed, and I chose to have it removed because he already had so many other neurological problems. I really didn't want to add to that. And then there's another question on here. It says, wisdom tooth cavitations make me nervous because of the proximity to the nerve. There are important structures all around each tooth, but when ensuring we can get the voltage connection back, it seems like so much bony material needs to be excavated. Teresa, I know that you're great with surgery. Do we have a video on cavitations? You have to remove enough dead bone. I'm sorry, what were you going to say?
I said it's coming.
Okay. When you're talking about removing, you know, sometimes a cavitation is not something that shows up on the x-ray. You have to have a massive amount of bone in order for it to show up on an x-ray where it's gone. It usually fills in with something else. If you talk to a radiologist that reads CBCT scans, they will tell you cannot see them on an x-ray. It's just not possible. And yet you've got dentists out there that are used to using x-rays, and they get very comfortable because they're seeing them over and over again. So I think what happens is you start to see things after the fact. You look at the x-ray and you envision there's something there, but then when you get in and you do surgery, you see it's exactly where you were envisioning on the x-ray before. And so that gives you a sense of, I mean, you're educating your own self. Does that make sense? Yes, Teresa.
So I have seen some cavitations on panoramic. Like you'll look at the panoramic and you see where the third molars used to be, you know, and you see the outline of it. I promise you, if you can see it on a panoramic, that thing is huge. Okay. But I have seen a few that way. I have not seen a ton of them that way. Most of the time you cannot see it on a panoramic. Most of the time it does take looking at a CBCT in order to see something. And there have been some times where even on the CBCT, it is hard to see, you know. But I will tell you, I've only had one patient that I've had to send to a more specialized doctor, somebody who's done thousands of cavitation surgeries, you know, because I love surgery and I'm good at it. But I had one patient where it was so large and so massive, and it was close to the border of her mandible, and I am positive that it was also involving her inferior alveolar nerve. And so I sent her to see Mike Margolis in Arizona. And when she came in to see me, you know, when she first came in to see me, I just did my normal exam, what I do on everybody, and I saw her scan, and I went, oh crap, you know, because that was one of the ones that I could see on the pano. I did not even have to look at the CBCT to know that what she had was these massive holes in her bone on 17, 32, and 4 and 5, where she had extractions done. You know, and poor thing, I just felt so bad for her. And I felt comfortable dealing with 4 and 5 myself, but since she had to go see Dr. Margolis for the other 2, I said, all right, you know what, let's just let him take care of all of that. And, you know, you get a feel, and I promise you go in with, I don't make huge holes. I'm not one of those people that likes to make giant holes in bone. It's not my thing, right? There are other people who are like, oh, you need to create a huge flap. And I'm like, no, you need to go as small as possible if you can. It's not always possible, but if you can, you try to keep your stuff smaller unless it's something large, and then you got to go in and make it larger. But generally
There's
speaking,
a question on here about what a cavitation is, and although tonight is supposed to be about root canals,
yes,
I'm going to try to describe what a cavitation is. When a tooth has been removed and the periodontal ligament was not removed, the blood clot that's in there cannot completely dissolve, and therefore your osteoblasts and osteoclasts can't get through that periodontal ligament in an effort to fill in with healthy bone. Now, cavitations can happen for other reasons, like prescription use of something like Imitrex, where it interferes with circulation to the jaw, or a trauma like a football injury. So there are other reasons. A root canal tooth can wormhole the bacteria out to an area where there was never a wisdom tooth and create a void called a cavitation. Or you could have a tooth bud that never did completely form, and there's a cavitation. Not every cavitation is a burden, just like not every root canal is a burden. There used to be a piece of equipment that we used that did ultrasound technology called a cavitat. Not every void in the jawbone is an energetic burden, and in that case, surgery is not necessarily needed. So it's not like you tell the person, oh, you had 4 wisdom teeth out, I bet you have 4 cavitations. We're just going to drill holes in there. The way I explain it to a patient is, imagine that you have a 2x4 sitting in front of you, and I give you a Black & Decker drill and ask you to drill a hole. You drill, 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 drill with constant pressure. Now I'm going to blindfold you, and I'm going to give you another piece of 2x4 for you to do the same thing. But in actuality, I trick you. I give you a styrofoam plastic cup with a piece of balsa wood on top, and I guide your drill to the top of that, and I ask you to use the same amount of pressure that you used when you were drilling on the 2x4. What happens is you instantly pop through that. There's a thin layer of cortical bone over this area that you pop through very easily, and if it's a true cavitation, you'll find fat marrow, because that's all that blood clot that never did break down. A lot of oil, sometimes some black spicules will come out. If you're doing cavitation surgery, you darn well better be sending your proceeds off, or it'll come back to bite you in the butt that you don't have proof that there was something in there, either pathology in the bone. Like in mine, when I had my cavitation surgery, on the right side I had osteomyelitis that came back from the path report, which is a horrible bacterial infection in the bone. So please be safe if you're doing cavitation surgery. And another question on here is, it says, please help, what if I extract a primary first in a young child? What about a metal spacer? Is that okay when I'm in peds and I'm reduce the pulp treatment? So question above is relevant to me. I'm sorry, I'm not really sure I understand it. Can you unmute yourself and ask the question?
I did. Thank you, Dawn, for this wonderful presentation. I'm very new to biological dentistry, and my question is that I'm also a functional medicine practitioner. I've reduced my pulp treatment significantly and really have resorted to more indirect pulp caps, and it's actually working very well. But there are cases where, I do hit the nerve. Now, what do I do on a 5-year-old with no 6-year molar there, and I have the space if I take that out? Is metal spacers okay? I'm so new to this that I'm not sure which is the worst evil. Is the metal in the mouth bad? Because I know that also is problematic. Or is taking the tooth out, because losing space is a reality?
Right. And it's only going to be a short time frame. I think there's a company out there, I want to say it's called Rocky Mountain. They make metal spacers and things that don't have nickel in them. So my issue with the metal is that some of those have nickel, and there's so
Correct.
many people that are sensitive to nickel that if you could use a nickel-free, that would be better. In my son's case, I knew that we were going to have orthodontics anyway, and we were going to go with Invisalign, and so I just didn't care if things moved around. We were going to have to move things around anyway, but that was a personal decision. Yeah, Teresa.
I do use metal spacers. There are times where there's just no avoiding it with a kid, but I look at it as it's a temporary thing until the permanent tooth comes in. It's not a lifelong burden.
So Teresa, then extraction is better than it's the better choice, right?
If a tooth is pulped, then yeah, the biological mindset is that the extraction is better than having a dead tooth in the mouth.
And okay, thank you so much, both.
Anybody else have any questions?
That being said, I do want to say that we have managed to save teeth with ozone that, I try really to avoid pulpotomies. There are times where, again, I'm sort of looking at it as a short-term evil where I have to, because, for example, if I've got a 2-year-old who's got bombed out first and second molars, and they have 4 more years to go before they have a 6-year molar, they got to be able to eat. I can't pull everything in their mouth. So those are the kinds of situations where you look at it as a pedodontist, because you're a pedodontist, right? You look at it and say, what is the absolute best good that I can do for this patient, and what is the least amount of harm that I can do?
Right.
So when I go into that kind of situation, I tell the parents we will reevaluate it as soon as the 6-year molars come in, and if we at that point can do something about, lessening the burden, if those teeth are a burden at that age, then that would be, not a bad thing to do. But a kid has to eat, so you have to use your best judgment.
In pedo, you're in a great place, and I always tell people there's nothing as good as what God gave you originally, which was that enamel that you were born with. If you listen to last night's presentation with Dr. Dannenberg, there would be a great opportunity for you to completely change not just one child's life, but an entire family. As we were discussing, what's the importance of flossing? And there's, like the IAOMT made a statement that flossing is not as important as we thought it was. So you don't have to tell a patient to floss anymore, which is really hard for someone of my mentality, because I still believe that that bacteria is an issue. But his was getting back more to those primal diets that people had. If they had good nutrition and they had a good immune system, they would be able to fight off that bacteria. So if you can teach kids good home care and you can change an entire family's diet, you might prevent the whole family from having insulin resistance or diabetes, much more than just that they have fewer cavities. So
yeah, Don, that has been a huge addition to the practice from IFM courses and lifestyles. So I appreciate you saying that, because it is already a huge part of the practice.
I would love to see you do some kind of a video to put up on the IABDM site to educate consumers about, the fact that they are making choices for their children's teeth as their adult teeth come in, based on what they're doing for them at infancy or before.
Okay, I tell you what, as I learned more from Katie Toe and Teresa, I just started this less than 2 weeks ago. You can check me out. I take deep dive, and I promise you that video, and I'm very good at videotaping, but I'm way too early in the process, and I'm here for my deep dive. So I'm here to stay.
I am going to hold you to that. I sure am. Teresa,
Yes,
do you want to show one more video before we call it a night? Do you want to pick something else? Sure.
All right, let me do that. Wait, where we go? Share screen. There we go.
Hi, my name is Martina, and I give Dr. Scott permission to share this video clip
to make you understand how important it is to have a healthy mouth. My story started in '86. I went to the dentist and I had pain. They opened me up. They said there was nothing going on. They opened me up. I had a severe infection. And it was not to be seen on normal pictures.
X-rays, okay.
X-rays. Anyway, to make a very long story short, I went home back to the United States and I came down with chronic fatigue community deficiency syndrome.
Chronic fatigue.
Yeah, chronic fatigue. So the infection was everywhere. Anyway, I had for years.
Did they do a root canal? What did they do when they?
Root canal.
Okay,
They root canal. They opened me up. I don't know what they did, but it was a lot of work.
And that was on the upper left.
That's on the upper left
Okay.
here.
Mhm.
Anyway, then many years later, years and years of complaints, fake complaints. The doctor didn't know what to do.
Vague complaints.
yeah.
Vague complaints, not fake complaints.
Vague complaints. So they didn't know what the cause was. I was fatigued. I was very depressed. I had weakness, which was very strange because I was athletic, very athletic, very busy. 15 hours of hardcore aerobics every week, and I cratered after that. So I ended up here with Dr. Scott. After I'd gone regularly to my own dentist, and I love the man, but he'd done many root canal treatments, and I had an infection again on the left. And well, the long story short here is that I had infections everywhere in my mouth. Dr. Scott took care of me, thank God.
So what I want to know is what has changed since all of that? Because it's been a little over a year now, right?
Yes, it has. It was a week after I'd gone through the procedure where everything was taken out. I felt free. It was a release in my body. It was like suddenly you put your glasses on and you see everything sharp. You felt stronger, you felt more alert, you felt more aware. It didn't have all the vague symptoms that I had before. It was a tremendous improvement in my health. And I cannot thank you enough to take care of me, because I would have been still struggling today. I still would be going to doctors with my complaints, not knowing what's going on. But it was in my mouth. All my problems came from my mouth.
So how do you feel now? Because it's been over a year.
I feel great. I mean, I would like to have some teeth because I love salad. I would like to have some salad, but and biting an apple. But it has been,
Night and day.
A year. It is tremendous. I would advise everybody, go and have it sorted out, because I had no symptoms.
No
That
symptoms
was
at
the
all.
thing. I had gone regularly to my doctor. I just had new bridges put in, and I was very careful with my teeth.
Yeah, very good oral hygiene, very good care.
But I had no symptoms until you took that beautiful X-ray.
And this 3D scan, there was a lot of infection.
And I remember,
in
I
there.
said, I could go throw myself on the floor and behave like a 2-year-old, or just take like a big girl and just listen to what she's got to say, because it was bad news. It was really bad news.
Yeah, you had a lot of infections.
Oh no, but you have taken tremendous care of me, and I would send everybody. You just take care of your mouth, because it is a difference between day and night. You can't compare it. It's like, I'm alive, you know?
I'm so glad.
I'm alive. So thank you, Dr. Scott.
All right, thank you so much, Martina.
And what I want to do is encourage those of you that don't really understand this connection, is be very careful as you start moving into this world of, oh wow, that's a root canal tooth that needs to be removed, and document. Don't just document, I mean, you're very good about the videos. Some of that stuff is more anecdotal, the patient saying that they feel better, which is incredible. But when you start seeing people who have changes in their lab work, or they had pathology in another area of their body and nothing has been done, no chemo, no radiation, and now they can't find the tumor that was there before. Those are the things I want to encourage you to make sure and document, so that you can do a case presentation. You're going to find lots of them. And just like Teresa has had aha moments where you you think, this is why I'm in dentistry. I mean, Teresa and I could sit here all night long and talk about mutual patients that we have where their life has been changed tremendously by just having dental work done. But because this is not what's taught in dental school, what's taught is the standard of care is to save a tooth at all cost. I am asking you, please consider the cost. Look at the health of the individual. Network with their primary care, which is hopefully an alternative-minded, biological or functional MD or DO or a naturopath that can help you create a team. It says, oh, Teresa wrote this. It says, you'd be surprised how many people suffer from depression that lifts after the infection of the teeth are removed. That's so true. Plus, teeth have memory. It's amazing to me how often a tooth would be removed and a person would start to whimper or cry, and you'd say, oh my gosh, you know, what's going on? And they say, you know what? I can remember the day that my brother hit me in the face with a cue ball and it snapped my tooth off and I had to go to the dentist and have a root canal. So those teeth have cellular memory, and as the tooth is being removed, which that was all hooey to me too in the beginning, but it just happens too often where the patient can recall what the brother was wearing on the day that he threw the cue ball at her face and snapped it off. So those are all the interesting things that happen in biological dentistry. Tonight, I just wanted to open your mind up for those of you that think that a root canal is a safe option. It may be a very temporary option. I'm going to ask you to continue to monitor the tooth. If you're a hygienist, I'm going to ask you to take a periapical of every root canal tooth when they're due for their annual bite wings so that you can document whether that tooth has a problem or not. I don't even know how many hundreds of x-rays where I took a periapical of an endodontically treated tooth and I said, oh wow, this doesn't look like it looked like last year. I need to call the doctor in and we're probably going to have to refer you out. A CBCT would be great, but of course you can't take that every year. You're going to have to depend on at least a periapical on the in-betweens. And yes, if you don't have a CBCT on your patient, the good thing for you to do is network with maybe an orthodontist or an oral surgeon so that you can have the advantage of looking at that film on the person. And there are radiologists where you can pay a fee for them to read the film and tell you things that they see on there. But as you get used to doing it, you'll start picking up on things. And there are some courses that you can take to help you read those CBCTs better. Okay, well, our evening has come to an end. If anybody has any complaints about something they saw, don't email me. No, I'm kidding. Email me with anything. We're here to help you through this time. I'm open to ideas of things that you'd like to learn. We're very passionate about holding your hand and helping you through this journey, as we call it. There isn't a destination because we'll never get there. It's always changing. And so we're on our yellow brick road to Oz. And I want to thank everybody. And tomorrow night, we'll have another speaker. So see you at 6 o'clock.
Night.
Thank you, Dr. Don.
Thank you.